Hello, hello. Welcome to Warriors Talk with author and founder Lady ReShell, where we move away from awareness towards action. It's Health and Wellness Monday, and our topic for today is conquering dental anxiety for a healthier you. We are live on Intellectual Radio. We just heard from the Drive FI with Roman. Keep it locked right here on Intellectual Radio and allow us to feed your brain. On the last episode of Warriors Talk, author Diane Williams and I discussed the new book anthology, You Don't Know My Story. You can head over to YouTube and type in Intellectual Radio and stay connected for any episodes you may have missed. The quote of the day is, "The fear of the dentist is often worse than the visit itself." The National Breast Cancer Coalition has their 2025 Advocate Leadership Summit coming up May the 3rd through the 5th for an exciting weekend of programming, and Lobby Day would be on Capitol Hill on May 6th. And the summit actually prepares advocates for a meaningful seat at the table where decisions are being made about breast cancer. You can head over to stopbreastcancer.org for more information. They are also having their 2025 Project Lead taking place July 27th through August 1st of this year in La Jolla, California. The registration, tuition fees, the course materials, and meals are provided. You are responsible for your travel and your stay, but scholarships are available. Again, you can head over to stopbreastcancer.org for more information, and the deadline is April the 25th. Please make sure you tell them that Warriors Talk sent you. If you are tuned in on any form of social media, like the show, share the show, and invite someone else in on the show that you feel may benefit from this valuable information. I am so grateful for my sponsor on today. We have Pastor Michael Richardson with the Emmanuel Church of God in Christ, who has a special message for us.
Greetings, I am Pastor Michael Richardson.
And I am First Lady Anastasia Richardson from the Emmanuel Church of God in Christ. We're located at 3058 West Van Buren in Chicago, Illinois. We are building upon a solid foundation.
And we're inviting you to join us every Sunday morning on Facebook Live at Emmanuel Kojic at 10:15 Central Standard Time. And you can also view our videos on our YouTube channel at Emmanuel Kojic-MR. Once again, this is Pastor Michael Richardson
and First Lady Anastasia Richardson. And we're from the Emmanuel Church of God in Christ. We are building upon a solid foundation.
My special guest today is none other than a skilled and compassionate dentist with over 30 years experience in the field, a graduate of the University of Illinois at Chicago College Dentistry. She was recognized for excellence with the Colgate Student Award. She further honed her expertise through an oral surgery fellowship, gaining extensive experience in oral surgery, anesthesiology, and treating medically compromised and geriatric patients. With a background in both hospital and private practice settings, she is dedicated to providing exceptional dental care and empowering patients to prioritize their oral health. Welcome to Warriors Talk, Dr. Monique Tucker, DDS. Hello, Dr. Tucker.
Hello, how are you today?
I'm good. How are you?
I'm blessed and really thank you.
Awesome. I'm excited about the conversation today because I know this particular conversation, a lot of people do fear the dentist. So what we're hoping to do today is to relieve some of that fear so that you can have good oral health.
Okay.
And the first thing I wanted to do was talk about the definition. What is dental phobia?
What is dental phobia?
Yeah.
Exactly what you stated, a fear of the dentist, which typically stems from some type of trauma that occurred in childhood. For most patients that I see, that's where it all started. And unfortunately, a lot of people carry that with them to adulthood.
How common is dental phobia?
Very. If I'd have to give you a guesstimate, typically if I see, let's say I see about 20 patients during the day, at least about 25% of them truly have a phobia when it comes to seeing the dentist or having actual procedures done.
According to research, it says about 36% of people in the US have a fear of dental treatment, with 12% having extreme fear, and about 3% of adults in industrialized countries may have dental phobia and avoid going to the dentist.
Lady ReShell, your audio is going in and out a little bit, so I didn't catch what you said previously. If you don't mind repeating it for me, I'd appreciate it.
No problem. According to research, it says about 36% of people in the US have a fear of dental treatment, with 12% having extreme fear, and 3% of adults in industrialized countries having the dental phobia and they avoid going to the dentist.
Yeah, I definitely would agree with that. Unfortunately, what happens when you avoid, typically dental things don't necessarily get better. They only continue to get worse, which can lead to tooth loss, tooth loss when it could have been treated, had the person gone when they should have.
I also found that the fear of the dentist is more common in females than it is in males. I was really surprised by that because women tend to go to the doctor more. But when I saw this statistic, I was like, oh wow. So I want to talk about understanding dental anxiety.
Okay. You have some questions, or you want me to offer you some solutions that I do at my practice?
Well, I want to talk about some of the most common fears that people have about going to the dentist.
Number one fear is the injections. Having the administration of local anesthesia, for example, for an extraction or for a simple filling. Needles are definitely a major point of dental anxiety for most people.
Why do you think so many people avoid dental visits?
Wow.
And what is the risk of delaying care?
Tooth loss, resorption of the bone or loss of bone, chronic gum disease that have been treated prior to. There's a lot of different factors that can occur to be treated.
Do you feel that dental anxiety is more common in a certain age group or community?
I wouldn't say in a certain age group. Again, I would base it definitely on past experiences. By the same token, if as a child you have a positive experience or you're exposed to a positive environment while going to the dentist, then as you continue going teenage years, adult years, usually it stays with you. So I would not pinpoint it as a factor with age or with a certain demographic.
At what age should someone start seeing a dentist?
Really, the recommendation by the ADA is as soon as the teeth start to erupt. So if you have an infant, typically their 2 lower teeth come in first, then the 2 uppers. Parents should schedule an appointment, just so that the child is able to get a sense of what an office is like, meet the assistants, see the dentist. Often with little ones, I just say hello. I introduce them to the toothbrush and to the chair and how it rises, how it goes back. And sometimes that's all you do in the first appointment. Then the patient can come back with the parent, of course, and then you expose them to a little bit more.
And that was one of my questions about breaking the cycle is how do you and your staff, excuse me, how do you and your staff help patients feel more comfortable when they sit in that chair? Because they're already afraid when they come in there, probably like you said, from past traumas or maybe horror stories that they heard about going to the dentist.
Mm-hmm.
So how are you eliminating some of that fear? And I think it really starts, not to cut you out, but for me, I think it starts when you introduce them as young as possible. So then they're used to going, have that fear as you get older and you hear the dentist drilling and the noise and you see the needles, you're like, oh my goodness. But I feel like if you introduce them younger, the younger you, then the more better they would be at going.
Absolutely. Yeah, typically that is how it is. For my patients, I have an approach where I really take the time to ask questions as to what was their primary reason for coming. How can we address that? I also want to know if they tell me this is what happened in the past. I try to reassure people that we're going to take it slow. I've honestly had patients in the past that literally would not open their mouth when they came to see me. And I was able to walk them through appointment after appointment, expose them to what we're planning on doing. Let's start off slow, breathing techniques. I've even prayed with some of my patients just to let them have peace and know that they can trust me. And it's baby steps that we do, little by little by little. And eventually, if not all of them, typically come around. It's just having patience and being nurturing and understanding where they're coming from. And then from there, they open up, they learn to trust. I have a fantastic staff. I have comments all day long about my assistants or from my front desk, how we greet people, how we treat people. It's a family type of setting so that people are very, very comfortable, when it's time to have care. And thank God it works out. We've got a lot of smiling faces and patients that they really appreciate the time that I've taken and the quality of care.
Dr. Tucker, are there any modern advancement in dentistry that makes the procedure less painful or less stressful for patients?
Yeah, there is. There are topical anesthetics that you can use to treat areas in the mouth. So if a patient just definitely can't tolerate the injection, there's it's similar to an ointment or like an Oragel type of thing that can be placed below the gum line. It sits there for 20 seconds. then we can start working, last about 20 minutes, but it gives us the ability to do a deep cleaning or periodontal scaling or even a small filling on a patient that just cannot tolerate injections. And then you also have the option of having a form of gas, nitrous oxide is what it's called, if you need to, just to help with anxiety, and or like Valium, which I can prescribe the day before, a couple of days before. The patient takes a tablet before the appointment, the night before the appointment, and they come in. They don't drive on their own. They have to have someone bring them in. And then you're able to work on them where they are much more relaxed. So yeah, there are options out there. You just have to be willing to try.
Awesome. How does poor dental health impact your overall wellness, like including conditions like diabetes, heart disease?
It can be something that is mental. A person who has diabetes, for example, or heart disease, a history of it, the bacteria in the mouth has been proven to be the same bacteria that's in the bloodstream, in the heart, for example, in the heart valve. So if a person has a heart condition along with advanced gum disease, this worsens over time. It exacerbates disease. The same with diabetes. If you have blood sugar levels that cannot be controlled, see your dentist on the regular basis for your checkup, for your cleanings, or your periodic maintenance visit. Your blood sugar cannot be controlled. So, and that can be detrimental. So it's very, very important to take care of your mouth, because it also means taking care of the rest of your body as well.
I remember before I was going through my chemo for breast cancer, and I went to see my dentist, and the dentist was like, I read on the internet somewhere, it was like, before you do chemo, make sure you get any work done at the dentist, because you don't want to be in the middle of treatment and then you need some work done. It would be a horrible situation. So I went to the dentist and I told him, hey, I was diagnosed and I want to see if I need to get any work done. And of course I did. I needed some work done. And I had to wait I had to push the chemo out at least 3 weeks so that the work that was done could heal me, because I was told if I get it chemo that it wouldn't heal properly. So I remember my oncologist was like, are you doing this purposely? Like, I'm like, no, the dentist said I had to wait. So I had to wait, and then I had to get a letter from the dentist saying that I was healed and I was ready to go. Yep. And I thought that was important. It wasn't that I was told, but I read it. So now I share with other people so that they know to take care of that, so that they won't have any issues when they're going through treatment.
That's right. It's absolutely true what you have stated. Something else comes to mind. I have quite a few patients that come in and say, oh, I saw my doctor and I'm going to get a hip replaced or a knee replaced. And they said, I need a dental clearance. And I said, yes, you do. And so I do my evaluation and I tell them, if I find something, we have to treat this, because you don't want to go through this surgery and this issue in your mouth cause secondary infection at the site where you've had your surgery. So you've got to take care of those things. People just have to understand and know that your mouth is it's like an airway to the rest of the body. It is very, very important to keep that bacteria down, to have your regular checkups with your dentist, whether you're coming to see me or someone else, and get your cleanings, get your scaling done. It is critical and it's very important. So that's an excellent example and point that you have just brought up.
We have a question by Mylea. She says, how can you find the right dentist for you? The last dentist she had was very expensive and would never finish anything in one appointment.
You broke up just a little bit. I heard the name Mylea. She saw someone. He was expensive. He or she was expensive. And what was the other thing that you said?
She wanted to know how can she find the right dentist for herself. And she said the last dentist was expensive and would never finish anything in one appointment.
Oh, okay. So definitely she could, for me, word of mouth is very important. So I reach out to a close friend, a neighbor, ask them who they see. Most of my patients, I do not advertise. I have patients that return because a neighbor has sent them, a child seen. So now I see mom, I see dad, I see grandma, and that's how my practice has grown. So I would say word of mouth is the first suggestion, because getting an opinion from someone you trust means a lot, especially when they've been treated by that dentist. Or secondly, if finances are an issue, it's easier to call your insurance company and find out if they have a provider that is in network. Typically, you pay less because that provider has agreed to the fee schedules and the terms of the insurance. So those are definitely are two very good options for her.
Awesome. What are some essential habits that individuals can do for maintaining oral health in between checkups? So we know we're supposed to go at least twice a year, but what can we do in between those checkups to make sure that we're maintaining?
The basics are very, very simple. Brushing and flossing or water flossing. Now, I highly recommend to all of my patients to purchase an electric toothbrush. I have a rep that I use from Oral-B as well as Waterpik. These two devices, they are electronic. They are spectacular as far as removing debris, removing food, removing bacterial buildup around the teeth, around the gums, and can make a huge difference between checkup appointments, if you're not able to get to the dentist, as far as maintaining the health of your gums, your bone, and your teeth. So definitely brushing ideally should be after every meal. If you can't do that, we all have busy schedules. The minimum should be twice a day. In the morning and before you go to bed, always have a habit of brushing, flossing, or water flossing. That is essential.
What's the length for brushing? Because some people may do like 30 seconds and think they okay.
Oh,
And,
no.
and what's the length that you should be
No.
brushing?
So the ideal thing to do when you brush, start with the upper right section or quadrant. We separate the mouth in 4 different parts. So upper right, you should be doing 30 seconds to 45 seconds. Then do upper left, 30 to 45 seconds. Then lower left, 30 to 45 seconds. Then lower right, 30 to 45 seconds. So you're looking at a minimum of 2 minutes that you should be using your toothbrush, okay, and brushing your teeth thoroughly. And you brush the cheek side, you brush the actual crown or the top of the teeth, the portions that you use to chew with, as well as the tongue side. Don't forget those different surfaces in the mouth.
Wow. All right. For someone who has not seen a dentist in a while due to fear, what is the first take?
Repeat the question, you broke up. What is the what?
If someone hasn't been in to see the dentist in a while because of fear, what is the first step they should take?
Call an office, let the receptionist know exactly what you said. I haven't been here in a while because I'm afraid. Schedule a consultation or schedule a visit for just an exam and x-rays. If you have current x-rays, bring those x-rays with you. That will save a lot of time. As well as on that visit, make sure you have your current list of medications and your medical history. That is very, very important. That is something that I review with my patients every time they come in, any changes, because we need to know if you're on certain medications and why you're taking them, how long, and all of that.
I would say especially blood thinners. If you're taking some type of blood thinners and you have to go in and get a procedure done, oh God, that's so important to let the dentist know so that you won't run
That's
into
right.
issues. So yeah, that's a great idea. Some people they may not even think to bring the names of the medication and say, "Hey, this is what I'm already taking before a
Right.
procedure happens."
Yeah, it happens every day with us. Well, then we have to stop. Okay, let's look on your phone. Let's see on your pharmacy app or your My eHealth app. Maybe there's a list there, and that takes time out of the appointment when you can already have that information done. And you mentioned blood thinners. Aspirin is another uh, medication, even though it's over the counter, it's also an anticoagulant or thinner. So that's important to know, as well as any history. Did you have a recent heart attack? I have so many male patients, especially, that don't mention that. Oh, yeah, I was, when you ask them, oh, yeah, I was in the hospital a couple weeks ago. They didn't even think to mention it. So it's very, very important because you want that visit to be thorough. You need to have a clear background of the patient's medical history, so that everybody's on the same page. Sometimes I need to get a clearance, or I may want some blood work done for that individual patient before I even start working on them. So you can find all that out in that preliminary visit.
How important is it to like not hop around? Because I know some people may go to one dentist and they're at another dentist. Like, how important is it to kind of like you do with a doctor? You stay with the doctor. They know what's going on with you. You don't have to, you know, get your records and have them transferred over, but everything is there in one place and they know what's going on.
Yeah, continuum of care is very important. You can see pattern, with how a person cares for themselves and for their mouth. So I don't advise that at all. Try to do your best to be with the same doctor, be regular about your appointments. For us at my office, when we see someone, if we clean them on that day, we automatically schedule them for their 6 month, 3 month visit while they're there. Because people are so busy, time goes by quickly. Before you know it, you've missed your appointment. And a year can go by, and patients all the time, they'll say, "Oh, I was just here. Wasn't No, I'm sorry, you weren't. The computer tells me when you came in last." And so it's so much easier to make that scheduled next visit so that you're on the books and you can keep your appointments and see your same provider.
Awesome. Can you share any success stories of a patient who may have came in and had fear and was able to transform their health, um, and overcame that fear?
Yeah, I have actually several. I had a lady in today, as a matter of fact. I had told her I would be on the show. Hopefully, she'll call in or something. And when she came to me, she didn't have insurance, and she's about in her 70s, and she was very much afraid, because she had a past experience that was very traumatic for her. And she was also embarrassed because she had quite a bit of periodontal issues, lots of tartar, stains, and she really needed treatment, but didn't want to be chastised or criticized. So first appointment, we talked, we did her x-rays, she met my staff, and we did just measurements, what we call periodontal probing, to see exactly the health of her tissue and the condition of it. And we scheduled her back and let her know, take her blood pressure medication, make sure you eat. Next appointment, she was afraid, numbed up. My assistant held her hand. We have stress balls that patients hold, and those have been like a god, really help people through it. They can squeeze. Deep breathing techniques that I work with the patient. I numbed her. We started cleaning her, went over oral hygiene. We take the time to show them via a model what to do, what not to do. So long story short, she came in today. We finished her periodontal scaling on one side, for the mirror, and she literally just started crying. She was so happy that she didn't feel the tar on her tongue anymore, and that her teeth were white and they were clean. And it's a very gratifying thing as a professional. And as she said, I thank God for you. And I told her, I thank God for you. I'm so happy that you're happy. That means the world to me. And I consider that a success story. When a person comes in, haven't seen a dentist in years, and it's a complete turnaround. She's cheerful, joyful, just relieved, that she can smile again. And it's a blessing. It's a blessing for people.
What are your thoughts? I heard a lot of things about root canals, that they're not good to have.
Mm-hmm.
What are your thoughts on root canals? How safe are they?
Oh, it's a very safe procedure, extremely safe procedure. And it's not indicated with every single tooth that has a large, but definitely, for example, if it's a 10-year-old molar, they hadn't seen the dentist ever since they were 10, and they need a root canal, then yes, I advise it. I have no problems advising root canals where it's indicated. Now, if a tooth has a large fracture and it can't be saved, then I'd say extraction, possible implant, or some other alternative. But I work with quite a few endodontists, which are root canal specialists, and that have been doing root canals for the last 40 years, and they have been very successful. So it just depends upon the condition of the tooth, how long that tooth has been that way also determines success, and who's doing the root canal. So no, I don't have any qualms with it. I think they can be definitely an advantage for saving teeth.
What about dentures versus implants?
Again, implants are it's a great option. It depends on the person's medical history. That's very critical. If the person is a smoker or smoker, depends on the amount of bone that's present in the mouth. So you have to look at all of the factors in regards to what's the best option. Where there's questions sometimes, because I do have some patients that will say, maybe I can do it. Maybe, I say, okay, let's do this. Let's set up a consultation with the oral surgeon, have a CT scan done where they evaluate the bone, the quality, the depth of the bone, whether there's grafting that's going to be needed or not. And that can expose the patient to things. Do I want to Do I want to spend the money? Do I want to spend the time that it takes? All of that, but both are great options. I had success with both. I do not place implants. I restore them. So I will do an attachment. I've done all on 4 cases for dentures where a person may have implants and have a denture secured on top of the implants, and they've been successful. So it just depends upon the case, the area, and the quality of the bone, as well as the person's medical history.
So if someone came to you and they did not have insurance, what are the options other than pocket?
You broke up again. What are the options other than, what was the last thing you said?
Other than paying out of pocket, what other options do they have if they don't have insurance?
We offer at my office 2 options of finance. One is called Care Credit. The other is Cherry, like the fruit. And basically, it's a simple application that they do on their own. It takes about 2 to 5 minutes. It's like a form of financing for dental services. They can request a certain amount, and they then will opt to have financing for 12 months, 16 months, 3 years, 5 years, whatever they can afford, so that they're able to start the services and pay via Care Credit or via Cherry.
Great information. I want to talk really quickly about some of the myths that are out there about oral health. And one of them, sugar-free sodas are better for my teeth.
No, that is a myth. That is false. They are not better for your teeth at all.
And number 2 would be dental health doesn't affect overall health. And I think you covered this a little bit.
Yeah, we talked about that earlier. That is false as well. Okay. Dental health can, if you have a poor, lots of bacteria in the mouth, it affects the rest of the body. It exacerbates any type of health condition. It make it worse. So again, it's important. See your dentist. Do what you need to do. Don't be afraid. Take that step. Have faith. Have faith over fear.
And number 3 says, I can't wait to see the dentist until it's an emergency.
Okay. Are you asking, is that a myth? I can't wait to see the dentist until it's an emergency. Okay. I don't quite understand that. What does that mean?
It didn't wait until it's an emergency.
The dentist didn't cause the emergency. The waiting is what caused the emergency. So I don't see how one has to do with the other, honestly. That's a little confusing.
Number 4, dental sealants are necessary.
Yes, dental sealants and my professional feeling, yes, they are necessary. They are preventative. And it's a very simple procedure. It does not require any injections whatsoever. They are terrific for the youth, for the adolescents. Applying sealants typically are for your molar teeth or the larger teeth in the posterior area of the mouth, and it can help prevent cavities forming. So yes, definitely, they are necessary.
Number 5 would be bleaching is bad for your teeth.
Well, I wouldn't say bleaching is bad for your teeth. I would say bleaching teeth without having a exam and regular checkups and making sure if you have cavities, you treat those cavities prior to whitening your teeth. I'm a little skeptical when I go through malls and I kiosk of people that so-called themselves dental professionals, but they're not really licensed, and they're offering bleaching or whitening when they shouldn't be. So that really scares me. You need to see a dental professional first, have an evaluation, make sure you don't have any open cavities, areas of receding gums. Get that area. The last thing you do after everything's nice and healthy, then you whiten the teeth.
That leads me to number 6. White teeth are healthier.
Oh, well, yeah, you can't just look at them and say that. So I would say that myth is false. You have to evaluate them. Just because they're super white does not mean they're healthy.
And the last one is dental x-rays are dangerous.
No, that's not true. In fact, at my office, offer digital x-rays, which is one of the lowest radiation exposure that you can have. If you'd like, any patient can also request having an apron placed on them during x-rays. They are not dangerous. That is a myth.
Dr. Tucker, can you give us some advice or some words of wisdom for someone who's struggling with dental anxiety?
You have to, again, I would say pray first. Pray that you are in the right location with the right person. Discern. You can do that. When you walk into a place, you can see certain things. You don't even have to talk to someone. You can discern. Again, the advice I gave earlier, talk to a family member or someone from church or a neighbor that you trust. Ask them, who do you go and see? And ask them why. Investigate beforehand. And worst case scenario, if you don't have the time to do that, you can.
And I think I lost her, but I am going to give you guys her information because someone asked about how to schedule an appointment with her. You can follow her on IG at Dr. Tucker 3, or you can call her office at Just Smiles Dental Center at 2133 South 17th Avenue in Broadview, Illinois. And the number is 708-865-0200. And she's back. Hold on.
The screen went black.
You can finish your thought. I'm not sure where you left off. It just went dark. I was just telling them how they can make an appointment with you or letting them know where exactly you were located.
Oh, okay. So, you have the address on the screen. I'm at Just Smiles, located in Broadview, Illinois, 2133 South 17th Avenue. My office number is 708-865-0200. Our office hours now are typically Monday through Fridays, 8 a.m. until about 3:30. We have one Saturday out of the month, but during the summer, we're not open on Saturdays. But I would love to see each and every one of you that tuned in. God bless you all. This was a lot of fun, Lady ReShell. Thank you so much for the opportunity.
Awesome. Thank you so much, Dr. Tucker, for relieving some of the fears that someone may have by going to the dentist. You guys, I hope that you were encouraged today to conquer that fear. You guys don't go anywhere. I want to highlight my sponsor, Gloria Dotson with Mary K, and she's catering to all of your beauty needs from head to toe. I encourage you to go to maryk.com/GDOTSON and make sure you tell her that Warriors Talk sent you. And Warriors Talk is always looking for individuals to share their journey. You can go to warriorstalk.org and let me know that you want to share your story. Don't forget to register for Lobby Day and the National Breast Cancer Coalition Leadership Summit. They are looking for advocates to come and learn how to take your advocacy to the next level. My Leah said that she is going to the dentist. She says, "Thank you so much for the show." You're so welcome, my Leah. Join me next Monday, you guys, right here on Intellectual Radio with Warriors Talk. Next week is Relationship Monday, and it will be with Resolve Gilmore. And you know, we always have some type of juicy topic. So I will leave you with these words of wisdom. Dentistry is not expensive, neglect is. Overcoming fear today prevents pain and regret in the future. As always, thank you for tuning in to Warriors Talk with author and founder Lady ReShell, where we are changing lives one warrior at a time.
This edition of Warriors Talk with Lady ReShell. To find out more about Warriors Talk, follow at Warriors Talk #1 on all social media outlets, and Warriors Talk with Lady ReShell on YouTube. Please join us next week and every Monday evening at 6 p.m. Central Standard Time on intellectualradio.com for Warriors Talk with Lady ReShell, where we encourage, educate, and empower you into action.